What's up, everybody? Joe Davern, Healthcare Solutions team, bringing you a series of videos called What the Healthcare, because if you haven't said what the hell when talking about health insurance, you must be darn lucky. Okay, so what I want to do is talk about some of the things that people are most confused about when it comes to insurance. And this right here is one of the biggest things, okay? When we're talking about how deductible, coinsurance, and max out-of-pocket all relate together and what they all mean, okay? My name, phone number right here. You can listen to all this video and learn these things, or you can always just call me, and I'm here to help in any way possible. But everybody I talk to wants to know about this number right here, deductible. What's the deductible going to be on my coverage, or is my deductible high or low? What they don't ever ask me about is what the coinsurance is and what the max out-of-pocket is, which, in my opinion, this is the most important number. So, for this example, which I'm going to run through very quickly, we're going to talk about a plan that has a $3,000 deductible, 80% coinsurance or 80-20 coinsurance with a $6,000 max out-of-pocket, okay? Every major insurance plan is going to have these details. They're always going to show you these numbers right here, all right? We're going to take an extreme circumstance as an example. What if somebody broke their arm, okay? In Chicago, people like to ride bikes around the city. I've seen guys get hit by cars, fall off their bikes, break an arm or leg. It happens. This is why we have insurance, right? Typical broken arm these days, you're talking about maybe an ambulance ride, go to the ER, getting checked in the ER, you're seeing surgeons, potentially having surgery, cast, physical therapy. I think I'm underestimating when I'm telling you that's about a $20,000 medical bill, okay? One reason we have insurance is because they have networks, okay? And as long as you go to an in-network hospital with your coverage, usually you're gonna get a network discount off of that bill. Typically, let's just say 50% to keep it easy. So that leaves you with about $10,000 in medical bills due to this broken arm, right? So let's talk about what the patient's gonna have to pay. Well, the deductible, that's always the patient's responsibility. So if something catastrophic like this happens, you're gonna be responsible for that deductible. So boom, $3,000 of the $10,000, that's your cost, right? You're paying that out of your pocket right away. No way to change that. Then, once your deductible's met, you have 80-20 coinsurance. That means the insurance company will pay 80% of every bill after that, and you're responsible for 20%. So 20% of that remaining bill would be 20% of $7,000, because $10,000 minus the $3,000 deductible we paid, which comes to $1,400. So for this medical bill, which was about 20 grand, you're probably going to be responsible for about $4,400 out of your pocket that you have to pay. Now, as an insurance broker, there's a lot of things we can add to your coverage that would wipe out this bill completely, okay? And we'll talk about that in another video, so keep watching. But also what this means is until your term resets, which is usually about a year, you still have about $1,600 left because your max out of pocket is $6,000. You paid the $4,400. You could still be potentially on the hook for another $1,600 if there's more medical bills coming down the pipeline, right? So when you're talking about your risk or your maximum exposure, this is the most important number, this $6,000, not the $3,000. And it's something to note. When you're looking at summaries of benefits of plans, a lot of times services are going to be listed, 80% coinsurance. Let's say outpatient surgery, it'll say 80% coinsurance. People will think that the insurance right away is going to pay 80% of the bills. Not the case. That coinsurance only comes into play after deductibles met. So now you know. Again, you can always call me at any time, 708-566-6589. I'm always here to help.